In the heart of the west region of Cameroon, a beacon of hope shone bright as the Michael and Marisha Pacha Foundation, a dedicated non-governmental organization, organized its 10th CASEC Medical Mission in Baloum, Penka Misha Subdivision, Menwa Division. For 3 days, from June 10th to 12th, 2025, a team of over 160 volunteers comprising doctors, nurses and support staff from various specialties came together to provide critical medical care to close to about 2,700 patients. The mission, which focused on cancer awareness, screening prevention, early detection and care (CASEC), was a resounding success. The Cameroon Baptist Convention Health Services Women's Program played a significant role in screening for breast and cervical cancer, treating pre-cancer of the cervix, administering the human papilloma virus vaccine, and educating the population on cancer prevention and early detection. Here's a glimpse into the other departments that made this milestone mission possible. The registration team efficiently managed the flow of patients, ensuring that all participants were accounted for and received the necessary care.
The registration department, which is the first step for every patient, for any patient to be taken care of. It was very, very nice this year around because a massive population came out. I couldn't believe, even though with the other campaigns it was quite enriching, but this time with Baloum, the people came out massively to get free screening and free medication from the Pacha Foundation as every other year.
The Vital Signs team administered tests for blood pressure, blood sugar, temperature and other parameters, thus providing crucial information for appropriate triage of participants.
The department is in charge of taking parameters. We check your BP rate, we check your pulse to see your heart temperatures, and also most of the cases we have in this area, we have seen that they are hypertensive. So from the vital signs now, we take them to the general medicine, and after general medicine, they are being sent to the various consultants. But for cases like high hypertensive cases, we send them direct to the cardiologist for immediate interventions.
The physiotherapy team used various exercises, messages and treatment plans to address bone, muscle and joint conditions and assist patients regain mobility and strength.
I was very impressed because we have many patients, more than 100 patients per day. So it was not easy for the physiotherapy to be working on the 100 patients per day. The two serious cases that we have today, the first case was dropping foot. Alors, the dropping foot was like the person lose the nerves, elevator nerves. So he was not able to put the finger up and do the plantar flex. Second case was paralysis of the plexus due to the accident with the bike. So the case was serious because there was a big dislocation of the bones, of the joint bones, shoulder bones. So what we do today was like we wanted just to maintain the joint.
Experts from the St. Elizabeth Cardiac Center Shishong provided critical cardiac care services, including screenings and treatment for hypertension and other heart-related issues.
The team is hardworking and well prepared to do the job. And since yesterday, we have been working to make sure that we satisfy our clients and we are also satisfied. We had several patients with very high blood pressure values. We are moving from malignant hypertension, hypertensive emergencies, and also hypertensive urgencies. So we have been having lots of patients that we are also referring for proper care in the hospital by cardiologists.
The sleep disorder team addressed problems related to sleep health, providing screening, medication and guidance on managing sleep issues.
It's a great pleasure for me to assist for this campaign. I receive around 50 patients, and I am very satisfied to see what I did for them, and their face, they look satisfied.
The pharmacy team dispensed free medication to patients based on prescription orders written by the consulting physicians.
See, I lost my voice. That means that the mission is going well, and we are working as hard as we can. And We had a lot of drugs, and we are dispensing a lot. This is the last day, and whatever is going to be left, we're going to distribute it to different medical centers. Fortunately, in this village, we have a lot of people with gastric ulcers, so we underestimated the quantities, and we are making sure we purchase enough to serve as many as we can. Also, one particular blood pressure medication we also ran out, but we are replenishing as time goes, so nobody is leaving here without the medication that is being prescribed to them.
The MOMEX lab team conducted numerous tests on various diseases, providing critical diagnostics support to the medical and surgical teams.
The turnover of the population is very encouraging. We've had cases of normal prostatitis. We also have cases of HIV among the young and the old. We do have cases of typhoid, chronic and current typhoid. We have cases of hepatitis B, but it is the disease is fairly well distributed on all ages. It's not like it's skewed to one age. We've sent a lot of cases. Some are going for referrals, some are going to the various units that they were sent from to the lab. So we have all the materials for the tests that were shortlisted to be run in this program. We don't have any challenge in that respect. So for a brief rundown of the tests, we are doing HIV, prostate specific antigen test. We are doing hepatitis B and C, malaria parasite, syphilis. Then we are also doing urine analysis.
The gynecology team provided antenatal and gynecological consultation and treatment on variety of women's health issues. The Pacha Foundation leveraged its partnership with the Université de Montagne in Bangante to provide services including teeth cleaning, filling of cavities, extractions, minor surgeries, and oral hygiene education.
It has been very impressive because we have increased the number of staff. The number of patients that we saw also increased more than the previous 3 campaigns that we did. We have seen a lot of dental caries in this town. And almost all that came in here today were treated. We have done a lot of scaling and polishing. People who have a lot of periodontal diseases, a lot of gingivitis were treated. We had enough medication. I want to thank Pacha Foundation for giving us all the materials that we needed today. The State de Montagne also supported us with the staff. Today we are up to 10 staff working here. There has not been any challenge because the materials are there, the personnel are there. We also this year we upgraded from simple consultation to treatment. The treatment this year has gone up, and in future we are going to upgrade to another higher level of outreach where we can do treatment like root canal treatment and all the rest.
The pediatric team provided critical care to young participants attending to their unique medical conditions.
It's been quite challenging. I think it's very different from the setting in which most of us work, especially myself. The population has been very welcoming. They've been very much anticipating of what they were going to receive. We've had at least 150 every day. So it's been very challenging managing amongst ourselves. I think the main issue we struggled with was crowd control as well. And there's been some challenging cases, some of which we've had to collaborate with our other colleagues from other departments. But for some patients, we've had to refer them back to local practitioners who we felt is more appropriate to manage. But overall, it's been satisfying, it's been fulfilling, and quite hopefully it's had an impact on the population.
Concernant la mission, la campagne de santé Pacha, mes impressions sont bonnes parce que voilà, depuis le début de la campagne, on a consulté assez de malades et au sorti de ces consultations, là, chaque patient est satisfait.
The family medicine consultation team provided medical care to adult patients who were disproportionately elderly and thus presenting with unique challenges. The mental health team addressed issues related to mental well-being, providing screening, counseling, and medication management.
Quite a good number of cases. We have seen more cases here than we did in the last mission. And here I've seen a number of cases of trauma battery that has led to stress and depression. A lot of family problems that leads to high blood pressure, nerve stress, And currently I'm actually seeing a case now with schizophrenia, which is the extreme of mental health issues. So I've seen some cases with depression and grief from loss, losing many children or losing family members. So
I'm not seeing so many patients with depression, but we're seeing so many patients with trauma type of stress and erectile dysfunction. One of the best cases we had was somebody with a tic that has since childhood, and I had also a hydrocephalus type of patient, which are interesting, but the one that we were supposed to see are depressed patients, people with anxiety, people with bipolar, and so on. We have, I think, 20 or 30% of the cases are depressed.
The team from Acha Eye Hospital, an arm of the Presbyterian Church in Cameroon Health Services, provided comprehensive eye screening and treatment for various eye conditions, referring cases for cataract surgery to the eye hospital.
For us, Acha team to be invited by Pacha Foundation, the activity passed well. We see a lot of patients, more than 300 patients. All the patient was satisfied. We have seen the patient, we come with instrument, with medication, with glasses, we dispense free. And the patient who need operation, the foundation has to pay a part of money for this operation, and they are very satisfied and happy. The village, they are very happy for this activity.
The team, led by Ascovim, a prominent partner to Pacha Foundation, provided surgical services while referring complicated cases.
I came here because I've got connections with the Pacha Foundation and the Pacha family as a whole. So in terms of cases we've seen some complex ones. We've actually referred 2 patients to Hôpital Central in Yaoundé under the auspices of Dr. Bouele, because they came in with very advanced hernia, abdominal hernia, which you cannot manage in a day case basis. So in terms of malignancy, talking from a medical perspective, when we say malignant, we mean cancer. I haven't encountered anyone yet. And from a surgical perspective, we did surgery, Dr. Bouele and myself yesterday. They were all manageable cases. The ones which we picked up, which we thought needed more support, Georges Bouele took them to Yaoundé. So those ones will be managed where he works.
So we have seen at the surgical department, over 55 cases with different pathologies, from herniorrhaphy, appendicectomy, myomectomy, and lipomas. But basically during the campaign, there were some cases that we could not handle here at the campaign site because of logistics, and the plateau technique was not really appropriate to manage those kind of cases. So we were basically doing most of general surgeries, more complicated surgeries like the thyroid surgeries that were there. We could not do it, so it was referred to
The ultrasound services provided by Transplant Cameroon afforded evaluation of the growing fetus, while the expecting mothers got to experience their first ever scan, complete with a keepsake printout of baby's image. Consultation and diagnostic support to field doctors was available from specialists in the United Kingdom, United States of America, and Cameroon through a visual link managed by Pacha Foundation digital team. The nutrition department provided counseling on nutrition and lifestyle choices that impact health. Meanwhile, Pacha Foundation Cordon Bleu team is dedicated to ensuring volunteers enjoy delicious and nutritious meals. The mission was made possible thanks to the Ministry of Public Health, a strong partner in health, and the local authorities. The visit from the divisional officer, the mayor, first vice president of the West Regional Council, and the Penka Michel District Health Officer was a pivotal moment in the mission. The authorities expressed great satisfaction with the services provided and praised Pacha Foundation for its effort.
Avoir fait le tour Nous pouvons dire que nous sommes
satisfaits. Obviously, after touring, we can say that we are satisfied with what we have seen. We found professionals working tirelessly who are dedicated to their task.
C'est un grand sacrifice.
Pour marquer ma satisfaction quant à la performance
I'd like
de
to
Pacha
express
Foundation.
my satisfaction with the performance of Pacha Foundation on the ground. Truly, in my 20 years as mayor, I have not seen such mobilization for the public good. As you agree with me, our populations are indeed suffering from illnesses, and as the first magistrate of the city, I am delighted that you have come to give a boost to the health of our populations. Once again, I sincerely thank you.
Une fois de plus, je vous dis sincèrement merci.
Avant toute chose, je voudrais exprimer ma gratitude à Pacha Foundation.
I would like to express my gratitude to Pacha Foundation, particularly its president and entire team, for choosing Baloum for this significant health mission. We have strong leadership. Good things benefits the population. As for the mission itself, I'm satisfied. As an elite, I'm delighted that the people of Baloum are receiving quality health care.
C'est à ce moment-là que les bonnes choses profitent aux populations.
The CASEC MedicalMission2025 was a testament to the power of collaboration and community spirit. The foundation expresses profound gratitude to all partners, sponsors, and volunteers who made all medical missions a success. The CASEC Medical Mission 2025 is dedicated to the memory of Penka Kenye Alex.